Welcome back to another episode of Board Bitesize. Today we are joined by our Chief Executive Jim Austin and our Chair Julie Holder. We've just finished April's board meeting and stepped outside to reflect on what has been discussed today, in line with our organisational strategy themes of people at the centre, working in partnership, healthy communities and focus on the future.
Hello everybody, it's Jim Austin here, Chief Executive at DCHS. I'm joined by Julie Holder, our Chair. Today we're recording this on Thursday the 3rd of April in the afternoon, and we've just completed our public board meeting, and Julie's going to start off with healthy communities. Julie.
Thanks, Jim. And we've been here at, as you say, at Ilkeston today, and we can see that it's great news about opening of the Community Diagnostic Centre. We've watched its construction, its progress, and it's a massive thanks to everybody who's been involved. It coincides with the walk-in services at the UTC, which has been really good to see all that come together. We also had a really important patient story today highlighting the work of the MSK service and CAT service and how our advanced physiotherapists are assessing people to help them retain and improve their quality of life. And in this case, we heard about a patient who had early onset arthritis and through exercise, but also the support of the team, was able to actually carry on with a fantastic quality of life. I really recognise from a personal point of view the potential of these types of services in the prevention agenda, especially because here I am sitting very uncomfortably today with an arthritic hip. I'd like to go on as well to talk about how we've been working in partnerships. So you'll talk more about this, Jim, when you pick up about the 25-26 planning process. But for me, I can see that this year it's felt much more joined up with our partners. We've been sharing key information and understanding of each other's challenges and priorities. So we've got a shared understanding of where there are difficult decisions to be made about fragile services. Also, our partners are really owning with us our community transformation programme. As a result of that, we're agreeing on fewer areas of collaboration that will make the most impact over the next 12 months and working together in areas like enabling services, estates, some clinical pathways and children's services. And we've heard today about the great progress in formalising the partnership with Derbyshire County Council to improve services around assessment and reablement. The one other thing that I thought was good to read in your report today, Jim, was that 13 of our primary care networks are going to be sites for the Empowering General Practice programme. And it's going to be good to really hear how that will integrate into the community transformation programme.
Thanks, Julie. So just looking at the people in the centre of the way that we work, it was Michelle Bateman's last public board meeting today, and that was acknowledged by you at the beginning of the meeting, and she's obviously been a great contributor. She's clearly around for the next 6 or 7 weeks, so it's not as if we're saying goodbye to her right away, but last public board meeting. We're well advanced with the recruitment of her role, and actually next week we'll be seeing the shortlisted candidates in a number of different types of assessment. So hopefully within a week or so we'll be able to announce who the new Chief Nurse and Director of Quality and AHPs is going to be. Very exciting work. We also briefly touched on the staff satisfaction survey, our best ever contribution rate. So that was fantastic to see, and a really good set of results nationally. And although some things have dipped a bit, and we will work on those areas, really overall a very good set of results. So thank you very much to everybody that contributed. 68% of staff took part in that, which is really good, and thank you for that. Finally, focus on the future, and Julie, you mentioned a little bit as we're coming through, we submitted our plan as part of the overall system plan. That's gone in and been accepted, and while the hard work starts now in delivering it, there's been a lot of announcements recently about NHS England, integrated care boards, and all sorts of other instructions coming through for NHS England. And some of you will have been picking that up through Team Brief or through the other communications, but we talked quite a lot about that in public board and then later in closed session of the board as well. Probably spent over an hour talking about that and the impact on us as a trust and us as citizens in a national health service system. I think what I would say is we will of course, adopt any of the requirements that are in the instructions that have come down. We need to be very careful and considerate of the colleagues in the ITCB and in NHS England who are directly impacted by these changes, and I'm sure that everyone will take that. But we too will have impacts ourselves that we'll need to manage. So we'll need to be careful with each other. We talked about the DCHS way and how actually doing the right thing is important in the right way, and we will make sure that we're adhering to that. There is discussion going on about, how should we organise ourselves as the NHS, and we talked at length around the board about we are going to continue to pursue the direction and strategy that we've had for well over a year now, and that we've been building up for the last few years, and that's working really closely in the out of acute hospital environment. So that's working with our local authorities, and you mentioned that, Julie, but also with general practice for the voluntary community, social enterprise and faith sector, really working with that at a neighbourhood level. And some of the things we're doing with Team Up, with our neighbourhood teams, is absolutely getting into the right space and comes back to the strategic place that the NHS is trying to get to. And so we're going to concentrate on doing that, delivering our plan really effectively, and knowing that we can control that, and you as listeners to this will be part of the delivery of that. So that was a very positive, challenging conversation at the board, but a very reassuring one that we are heading in the right space. Anything close up from you then, Julie?
I think it's just about acknowledging that it's tricky at the moment. Times of change, it can be very unsettling for people, and we talked a lot today about supporting people through that times of uncertainty. Some people really thrive on change, but others perhaps have a more difficult time through change processes, and we need to respect that in each other. But it's been a really good day, I think. I feel quite energised. So I'll say goodbye to everybody.
And I'll say goodbye too.
That's all for today's episode. Board Bitesize will be back after the next public board meeting.